Good afternoon, everyone. Welcome. It's good to see you all. My name is Emily Shetty. I'm the chair of the Health and Social Services Subcommittee on Appropriations, joined by our amazing colleagues, Vice Chair Jones, Delegate Ruff, Delegates McCaskill and Heinbaugh, our awesome subcommittee council, and by special appearance, we're super privileged to have chair of our full committee, Chairman Ben Barnes from Prince George's and Anne Arundel counties. He's joined because, as you all know, this is an incredibly important part of our budget that has received a lot of great engagement and feedback from members in the community, many of you here in the audience, and many who could not join us today. So I want to take a moment to just express some gratitude for all of your engagement and advocacy. For those of you who have never been before our subcommittee, we strive to maintain a positive culture of respect and create a warm environment where all voices can be heard, because we recognize the impact that these budget policies have on Marylanders. And so we as a body have a really important oversight role over our budget, and we take that role very seriously. But in this particular section, it's especially important to us that we hear from each of you. And I hope that you feel at the end of the day that your voices have been heard, and we are taking every single piece of feedback under strong consideration as the legislature does its review of the proposal from the governor. So with that said, the format for today, again, if you've not joined us before for a budget hearing, is we start with our Department of Legislative Services analyst, who will provide a presentation on the governor's budget request, as well as any additional recommendations that DLS, our nonpartisan arm, has for the legislature to consider. Then we will do questions from our subcommittee members and chair, and then we will hear from the administration in their response to the budget analysis, and we'll do questions, and then we will hear from advocates. Advocates will get 2 minutes each to testify. We have noted individuals who require special accommodations in our list, and we have that information here. Our trooper has been really amazing. He's trying to make sure that when we get to that part of the testimony, that we are able to hear from all the people in the order in which I have them listed here. And so I just ask you to kindly listen to his direction so that we can make sure that all of the advocates that were signed up have an opportunity to be heard. So we will begin, as we always do then, with our analysis from our DLS analyst, Victoria. Thank you.
Thank you, Madam Chair and members of the committee. My name is Victoria Martinez. I'm with the Department of Legislative Services, and today I'll be presenting the Developmental Disabilities Administration Budget Analysis. DDA provides services to individuals with intellectual and developmental disabilities, primarily through state facilities and community-based services. As you can see on the first page of the analysis, the fiscal 2026 allowance decreases by $190 million, or 6.6%, for a total of $2.7 billion. Moving on to the discussion of the performance analysis, beginning at the bottom of page 4. The first performance measure discusses DDA's goal of increasing enrollment in a home and community-based services waiver to allow DDA to claim federal funds for services, as shown in Exhibit 1 on page 5. In fiscal 2024, there were 20,000 individuals served in community services, of which 19,000 were enrolled in a waiver, representing a slight decrease from 2023. Exhibit 2 on the next page shows enrollment in each of the 3 DDA waivers, and Exhibit 3 on page 7 summarizes the services offered in each waiver. Redetermination for Medicaid waivers typically occur annually, but this was paused during COVID-19. When Maryland resumed the redetermination process in April 2023, there was an error in which some participants were inappropriately disenrolled. MDH reported having reinstated 304 participants that were inappropriately disenrolled. The second performance analysis, beginning on page 8, discusses the community services waiting list placements. Exhibit 4 on page 9 shows that there were almost 4,000 individuals on the waiting list in fiscal 2024, which is an increase from 2023. The last performance measure discusses improvements in meeting person-centered plan goals. There are 3 goals related to timely review of PCPs that were established in fiscal 2022. And Exhibit 5 on page 11 shows the improvement in meeting these goals from fiscal 2020 to 2024. Moving on to the discussion of fiscal 2024, beginning on the bottom of page 11, as required by the budget bill, DDA submitted a report on advanced payments given to assist providers in their transition to LTSS. DDA provided a total of $457 million in bridge payments, most of which have already been recouped. To recoup these payments, DDA created accounts receivables, and DDA covered $346 million of spending in 2024 with these recoupments. DLS determined that this report required by the budget language was in compliance and recommends that withheld funds be released, and will process a letter to this effect if no objections are raised during this hearing. Because information on accounts receivables was not provided at fiscal year closeout, DLS recommends restricting funds until a closeout report and closeout budget amendments are submitted. Moving on to the discussion of fiscal 2025, beginning at the bottom of page 12. The fiscal 2026 allowance includes 9 deficiency appropriations that add a total of $740 million to the fiscal 2025 working appropriation. This includes an increase of $900 million for community services spending and a decrease of $160 million due to various cost containment actions. Moving on to the overview of the agency spending, Exhibit 6 on page 14 shows an overview of the agency spending in fiscal 2026. About 97% is for provider payments in the community services program. The remaining 3% includes spending for the federal disallowance, utilization review services, regional offices, and other operating expenses. In 2018, DDA received a formal disallowance letter from CMS regarding unallowable Medicaid costs. DDA submitted an appeal that was denied in October 2024, so the fiscal 2026 allowance includes $39 million to pay for the disallowance and for accrued interest. Exhibit 7 on page 15 shows community services spending, the majority of which, 53%, is for residential services. Moving on to Exhibit 8 on page 16, this provides a breakdown of the $190 million decrease from the fiscal 2025 working appropriation. Most of this change is within the community services program and is mainly attributed to a year-over-year decrease of $297 million for cost containment actions. This decrease is partially offset by increases of $37 million for expansion of waiver services and $28 million for a 1% provider rate increase. The fiscal 2026 budget plan includes significant cost containment actions, including reductions of $160 million in 2025 and $457 million in 2026. Exhibit 9 on page 18 shows the reductions from the cost containment actions as budgeted. Since most of these actions introduced in 2025 are ongoing, 2026 shows the annualized cost savings from these items. The savings of 3 of these cost containment actions were incorrectly estimated, leading to a projected deficit of $88.6 million in 2025 and $5.9 million in 2026. Exhibit 10 on page 20 shows the correct cost containment reductions, with the text highlighted in green showing a difference from the original budgeted amount. DDA reported that the geographical differential elimination, the action to direct transitioning youth into the traditional model, and the self-directed services cap on IFDGS require CMS approval. Since a waiver amendment hasn't been submitted yet, the geographical differential elimination will not be able to go into effect in fiscal 2025. Other changes include correcting the budgeted effective dates and fund splits for some of the actions, and DLS has asked that DDA provide an update on submitting the waiver amendment to CMS for needed actions and to comment on plans to correct the deficit. Exhibit 11 on page 22 provides a summary of each of the cost containment actions. Some of these actions reduce services provided to participants, while others impact the rates that providers receive. 3 cost containment items are contingent on passage of the BRFA, including the waiting list equity fund swap, the list program elimination, and the self-directed services cap on IFDGS. Moving on to the discussion of personnel on page 29, there are no significant changes. The vacancy rate remains high with 29 vacant positions, which are shown in Exhibit 14 on page 30. Moving on to the discussion of the issues, the first issue discusses DDA's community services spending and transition to LTSS. Exhibit 15 on page 31 shows actual community services spending compared to the legislative appropriation, showing that spending surpassed the appropriation by significant amounts, including by $724 million in 2024 and $749 million projected in fiscal 2025. Exhibit 16 on page 33 shows the general and federal fund split for community services spending. Although spending is typically paid for with a little bit over 50% general funds, DDA received additional COVID-19 related federal funding that covered increased spending in 2021 to 2023. But in 2024 and 2025, there were less federal funds and more general funds were needed to cover the growth. Exhibit 17 on page 34 shows the yearly growth in community services spending. The highest year-to-year growth was in 2024, with a growth of $590 million over the previous year. And Exhibit 18 on page 35 shows what is driving that growth in 2024. Some of the key components of the increase were expected, such as 2 provider rate increases, but the factor driving growth the most is an increase in spending in the traditional model, which is mainly attributed to the LTSS transition. The LTSS transition was finalized in September 2024 and included moving providers from a prospective payment model to a fee-for-service reimbursement model in LTSS. Since most providers transitioned in 2023 and 2024, these years had the highest growth in spending. Throughout the LTSS transition, DDA was required to submit quarterly reports with spending forecasts of what fiscal 2024 would cost, having providers billing in LTSS. Exhibit 19 on page 37 shows the first 3 spending forecasts that DDA submitted compared to actual spending for fiscal 2024. In the first forecast, DDA estimated that the cost would be about $1.8 billion, and actual spending was about $908 million more than this original forecast. So DLS recommends adding language restricting $2 million pending quarterly reports with monthly spending data, and DLS also recommends not releasing these funds if the reports are late. Most of the growth in costs throughout the LTSS transition is estimated to be due to the increased rates that were built into LTSS. Exhibit 20 on page 38 compares the total per person per month costs in both systems, showing that reimbursement provided for services were about 18% higher in LTSS. Considering the significant growth in spending beyond budgeted levels, DDA did not accurately project the affordability of the new rates and the impact that it would have on the state budget before implementing the LTSS transition. So DLS has asked that DDA comment on how it will set rates within its budget going forward. In addition to the higher rates in LTSS, providers have received several rate increases in the past 10 years, as shown in Exhibit 21 on page 39. Due to the fiscal outlook, DLS recommends eliminating the provider rate increase of 1% in the fiscal 2026 allowance. Moving on to the second issue beginning on page 40 is on spending growth under the self-directed services model. Individuals have the choice of participating in two service models, the traditional or the self-directed model. The main difference is that through the traditional model, a participant receives services through a provider, while in the self-directed model, a participant has employer and budget authority and can choose who provides their services. Although individuals in both models receive an approved budget based on their assessed need, participants in the self-directed model manage their own budgets and can spend any unallocated funds or savings from underutilization of services. Exhibit 22 on page 41 shows the growth in enrollment and total spending in self-directed services. And Exhibit 23 on the next page shows the spending per participant by service model. This shows that spending has been increasing in both models, but enrollment and spending in the self-directed model has been growing at a faster rate in 2024. Exhibit 24 on page 43 shows the community services spending by service model. In fiscal 2026, the traditional model decreased by about 2%, while the self-directed model decreased by about 41%. In addition to the cost containment decreases in self-directed services, there is a $16.8 million decrease that DLS has asked DDA to explain. Beginning at the bottom of page 43 begins a discussion on recent changes to self-directed services. DDA recently published the Self-Directed Services Manual that went into effect in November 2024 that included several new documentation requirements. One of the changes is that to access goods and services through IFDGS, participants are now required to submit 3 months of personal bank documentation and a list of all planned monthly expenses showing that they do not have other funding available. And so DLS has asked that DDA comment on any privacy concerns from requesting participants' bank statements and any additional administrative burden. The last issue on page 45 discusses the adequacy of the fiscal 2025 and 2026 budgets. Considering the rapid growth in community services and actual spending consistently surpassing the legislative appropriation, it's unclear whether the 2025 and 2026 budgets are adequate. A rough estimate by DLS indicates a projected shortfall of about $150 million in general funds for fiscal 2025, and a shortfall is also very likely in 2026 given these trends. And so DLS has asked that MDH comment on the adequacy of the fiscal 2025 and 2026 budgets, in addition to providing the anticipated deficits and plans to reconcile the shortfall. I'll end with going over DLS's recommendations, which are listed beginning on page 46. I've already gone over recommendations 1, 3, and 5. The second recommendation is regarding the fiscal compliance audit issued by the Office of Legislative Audits. The audit indicated that DDA had 4 more repeat findings, and this language restricts funding pending corrective action by DDA. And the fourth recommendation is annual language that restricts appropriations provided for the community services program for that purpose only. And so with that, I'll end my presentation, and I'm happy to take any questions.
Thank you so much for your thorough and thoughtful analysis and recommendations. Do any members of the subcommittee have questions, or Mr. Chair? No? Okay, thank you so much. You can come join us here if you don't mind. We'll now invite Deputy Secretary Marlena Hutchinson and team to the table, please, to share your response as well as your thoughts on the budget proposed by the governor. Thank you.
Good afternoon, everyone. My name is Marlena Hutchinson. I'm the Deputy Secretary for the Developmental Disabilities Administration within the Maryland Department of Health. Here with me today, to my left, is Mr. Nicholas Gabor. He is DDA's Director of Finance. And to my right is Mr. Robert White, who is DDA's Chief Operating Officer. Thank you, Honorable Chair Barnes and Honorable Chair Shetty today, as well as Honorable Vice Chair Jones and the honorable members of the House Appropriations Committee. The Developmental Disabilities Administration within the Maryland Department of Health is grateful for the partnership with this Appropriations Committee as we continue to strengthen and stabilize the DDA service delivery system. Right now, we know that many in the disabilities community are feeling frustrated, disappointed, and anxious about what lies ahead. These are challenging times. Maryland is facing a $3 billion budget deficit, creating significant financial challenges. There is also a lot of uncertainty and much angst around future federal funding to states and human services programs. Acknowledging some of these dynamics, there are many contributing factors that lead to difficult budget decisions. But we understand that the strength of our community is measured by how we uplift and empower one another to work together to solve these huge problems. The disabilities community has stepped up and they've made their voices heard. The Maryland Department of Health fully recognizes that the proposed reduction in the DDA budget has real consequences for people who rely on these services. We were very glad last week to be able to restore a significant majority of the funding for the DDA services in fiscal year 2025 in partnership with the General Assembly, and we thank you very much. As we move forward to the process of passing a balanced budget for fiscal year 2026, we have no higher priority than the people of Maryland as we navigate federal and fiscal uncertainty. Along with our partner agencies, the executive branch, and the legislature, we are actively working to engage with participants and families, providers and advocates, as well as stakeholders to listen, collaborate, and find sustainable solutions. Together, we are actively working to explore alternative approaches to protect these essential programs while balancing fiscal realities. Together, we are actively working to seek federal funding opportunities that can supplement and stabilize key services. And together, we will consider budget reallocations and cost-saving efficiencies to minimize disruption to individuals and families. Please be assured that we are here as a partner, and we will stay true to our commitment to continue working as hard as we can to find solutions to work through these terrible fiscal times. We believe that you want the same, and please know that we share these common goals. Now, I would like to briefly summarize the Maryland Department of Health's written responses to the Department of Legislative Services questions and recommendations before opening for questions from the committee. From the Department of Legislative Services, questions related to the status of submitting a waiver amendment to CMS to enable certain cost containment proposals, the department notes that a waiver amendment is necessary to implement the cost containment proposals related to the geographical differential rate and individual and family-directed goods and services. It is also very important to note that the department no longer anticipates needing to pursue the action to limit transitioning youth to the traditional or community provider service delivery model, as we believe that the proposed changes to the model and the respective cost containment policies will result in this action being unnecessary. The department will continue to work with the executive branch, its partner agencies, the legislators, and the community to monitor and engage to monitor and manage the implementation of the proposed cost containment strategies. Understanding that waiver applications require a minimum of 30 days of public comment and then a minimum of 90 days for CMS to approve applications, the department will adjust its timelines accordingly. Regarding DLS's request that we comment on plans to correct the inaccurate estimating of the cost containment savings in fiscal year 2025, and that we replace the federal funding that was inadvertently reduced in the governor's allowance related to the low-intensity support services program, the department is working with its partner agency, the Department of Budget and Management, to update these items. Related to the Waitlist Equity Fund, the DDA currently estimates that approximately $15.9 million will be available in this fund at the end of fiscal year 2025, which is June 30, 2025. Related to the requested report on fiscal year 2025 year-to-date community services spending, the department submitted the report to the legislature on February 18, 2025. We apologize for the delay in submitting the report, and we will work with the Department of Budget and Management to improve timeliness of future submissions. Related to the tracking affordability of LTSS Maryland rates, the department notes that it will continue to utilize its current rate review advisory group and the Hilltop Institute. Related to a $16.8 million decrease with the Department of Legislative Services, which the Department of Legislative Services observed in the self-directed services model, the department requests follow-up with the Department of Legislative Services for additional clarification. Related to the Self-Directed Services Comprehensive Policy and Manual introduced in the fall of 2024, the department notes that these policies are not designed to, and they are not anticipated to generate cost savings. The updated policy and manual improved documentation requirements to enhance program integrity and compliance in accordance with state and federal standards. Related to the requirement that participants not have other funds available to purchase optional goods and services through individual and family-directed goods and services, the department notes that this requirement is a part of our service requirements for this service. DDA's tools meet HIPAA requirements, and previously, we just want to note that participants attested to having this documentation and being willing to provide the documentation upon request. Now that it is a documentation requirement, participants must provide the information upon submitting their request to the department for consideration. Related to anticipated additional shortfalls in fiscal year 2025 and fiscal year 2026, the department notes that it is working closely with the Department of Budget and Management to update the administration's DDA cost projections for both years to reflect changes since the time the governor's allowance was finalized. Like DLS, we currently estimate additional shortfalls in both years due to a combination of continued increasing cost trends since fall 2024, as well as changes to our projected savings from cost containment actions in fiscal year 2025. The administration is working on a proposed FY 2025 deficiency request and supplemental budget for fiscal year 2026 to resolve the additional projected shortfalls. We understand that DBM anticipates sharing the administration's plan with the legislature in early March of 2025. Related to the three recommended reporting requirements, the department concurs. And again, those reporting requirements are around adding language restricting funds pending the submission of a report on fiscal year 2025 closeout and closeout budget amendments, adding language restricting funds pending the resolution of repeat audit findings, and adding language restricting funds pending quarterly reports on community services spending, enrollment, and utilization. Related to language restricting community services appropriations, the department respectfully disagrees. Related to the recommendation to remove the proposed 1% provider rate increase in fiscal year 2026, the department acknowledges DLS's recommendation to the legislature. Thank you very much for your time this afternoon. Also available again are the Director of Finance, Mr. Nicholas Gabor, and the Chief Operating Officer for DDA, Mr. Robert White.
Thank you so much, DDA team, for being here today and providing your thorough and thoughtful responses. And we're going to turn to subcommittee members for questions now. I see Madam Vice Chair.
Thank you so much, Chair, and thank you, Deputy Secretary. And also thank you for your comments as you continue wanting to be a partner with us and find solutions. That means the world. I had just a few questions, some of which I normally ask everyone who comes before us, and we really understand, or maybe most days I don't understand, the federal government and we know that the current congressional leadership is trying to outline as best as they know federal Medicaid funding and how that could be cut. Are you all able to analyze the impact of the combined state and federal cuts and the possibility potentially of cutting the federal match with this year's reductions, or are you planning out anything? And how are you able to plan out potentially with the federal government acting the way that it is?
So right now, the administration, or I should say the agency itself, is tracking very closely what's happening at the federal government. I am actually participating in various national meetings, watching what's happening at the federal level. As you know, things are happening oftentimes in a nanosecond. Mm-hmm. So I work very closely with the Deputy Secretary of Medicaid as well, Dr. Ryan Moran. And so the department is tracking very closely right now.
Thank you so much. And then I had a question from several constituents, and it's in regards to proposed cost containments with DDA. And in some cases, the dedicated one-on-one services with higher behavioral and medical support needs. For example, they might have seizures or a risk, a fall risk. And in those cases, sometimes they're being told that their services are only intermittent and non-continuous. And we're trying to work through those constituent needs. But if possible, if we could, would DDA be able to resume honoring those commitments and accesses to dedicated supports that were previously given for epilepsy or risk of falling?
So what I can assure you is each participant's situation is actually reviewed by my regional offices. And when an individual has medical or behavioral needs, we are honoring those dedicated hours. It has been brought to my attention that there have been times where a decision has been challenged, and I strongly encourage the providers or families to please bring those to our regional offices' attention or my attention personally. I've been looking at some of these cases myself, looking into them directly, just to make certain that those resources are available to individuals when they qualify for those services.
Thank you so much. I appreciate that, and I appreciate you addressing it. Thank you, Chair.
Thank you, Madam Vice Chair. Thank you, Madam Deputy Secretary. I don't see any other questions from subcommittee members, but I do have a request, please.
Sure.
Oh, I'm sorry. Forgive me. Delegate Ruff, I'll do my request last. Go ahead.
Thank you, Madam Chair, and thank you to the panel. Thank you for all the work that you're doing for this community, which is very, very important to support those who are very vulnerable. And I wanted to talk about the person-centered plan managing for results that you guys have displayed since 2022, I think. I wanted to just note that it was really encouraging to see the response times that have astronomically gotten so much better. I wanted to know what you all do to support families when the ball is put back in their court, when they're trying to revise or re-up or renew their person-centered plan. I personally have a constituent, Curtis Cooper, who has a 22-year-old daughter named Valerie, who lives in the 41st District, who is a bit frustrated right now trying to get a plan renewed for her, centering around one-on-one aid. And I've talked with your department, and I feel confident that it's being addressed. But the ball is kind of back in his court right now, dealing with how to get the information needed to kind of combat, I guess, a negative decision to remove the one-on-one aid. So I'm wondering how you all can support individual families when the ball is placed back in their court to make sure that they're empowered to give the information that they need in order to get the outcome that they're looking for.
That's a great question. So we have case management agencies that are contracted with the Developmental Disabilities Administration, and they are there to support participants, not only in developing that person-centered plan, but in the event there is a decision that the participant does not like, the case managers can assist the participant with filing a fair hearing is what we call them. So those services and supports are there by way of our case management entities. If families remain dissatisfied with their case managers, they can definitely reach out to our regional office and seek additional assistance that way.
Very good. And I must say, I spoke with Ms. Renwick about this.
Okay, so this is central.
She was very, very helpful in getting this resolved. And hopefully I'll be hearing back from her in that 20-day time window.
Yes, absolutely. And please don't hesitate to reach out to headquarters if you're finding challenges with our regional offices as well.
Thank you so much.
Absolutely.
Thank you, Delegate. Thank you, team. I wanted to go into my requests now, please. So first, I want to thank you for really taking time to listen to the concerns of the community members that are here today. I will ask you, as I always do, to please make sure you stay for the testimony of the witnesses that have signed up, because as is the custom of our little subcommittee, we want to make sure that the agencies have an opportunity to hear the same feedback we're hearing. But my request to you is we have been hearing a lot of really wonderful proposals and feedback and taking many, many meetings from advocates on what they'd like to see as alternate ideas for how to achieve these cost-containing goals while ensuring less pain to the beneficiaries of these programs that are really important. And we've been working with DLS to try and get modeling on what some of these numbers could look like. But to date, and I think it's been a couple weeks now maybe, we've still not been able to get numbers as they've shared with us. DDA is still not been able to provide them. So my request to you, please, is please have your team work with DLS quickly, with haste, so that we can get those numbers by Tuesday. We would love to have them so that we can be able to continue to have these really important discussions.
Absolutely.
Thank you, ma'am.
Thank you.
Thank you. Anyone else? Great. Thank you. Please join the audience for a bit, and we will begin now with our advocate testimony. And just again, a reminder, we're very fortunate, so thank you, Mr. Chairman, for allowing us to move from our little space that we're typically in to be in the big hearing room. We're very fortunate to have 5 chairs up here, so what we're going to do is we'll call people up 5 at a time in the order in which you are listed in my sheet. Our trooper who's wandering around somewhere has access to this as well. My ask of you is, as I know that there are people waiting outside to be able to be in the room when it's their turn, my ask of you is, once you've had an opportunity to testify, please exit as quietly as you are able so that we can continue to hear from everyone that is here. And each advocate will get 2 minutes to testify, and then we'll take questions for the full panel by subcommittee members. So I'm going to begin calling individuals, and you can make your way up to the front when you're able. Tim Weens with the Maryland Inclusive Housing, Inc. Matt Rice with People on the Go Maryland. Kashena Cross, Mayor of Glen Arden. Catherine Donahue with SEEK. And Katrina Kugel with SEEK. So those are the first 5. Please join at the table. Move whatever chairs are needed, please, to support your ability to access the microphones. And then once we have our first individuals seated, we'll go in any order. Just take a moment to please go ahead with your testimony. Just introduce yourself so we can mark who you are on the list. You can begin when you're ready, in any order.
That's fine.
And Joe will be timing, so once it's 2 minutes, we'll let you know. Thank you.
Good afternoon, respective chairs and members of the subcommittee. My name is Matt Rice. I am the executive director of People on the Go Maryland, which is Maryland's statewide self-advocacy organization ran for and by those with intellectual and/or developmental disabilities. Our 400 members plus are supported by the Developmental Disabilities Administration, and so therefore we are here to testify in strong support of the Developmental Disabilities Administration budget and to please ask the committee to restore as much of the funding as is possible in these tough fiscal times. I want to note that while the department has noted that policy changes are often are not happening right now, that is not the experience of advocates in the community. We are seeing delays in person-centered plans with endless clarification requests. We're seeing the delays in wage exception forms being processed for those who are in the self-directed services model, and we're seeing delays or reductions in dedicated supports for those in the provider services model. I just want to be clear that I'm not here to represent one particular service model over another. It is the perspective of POG that all people, regardless of service model, have the supports they need and the appropriate funding in order to retain and recruit high-quality direct support staff. What is not clear is, with the proposed budget cuts, whether or not the current rates will be able to be retained for current direct support staff. I have one direct support staff who has 2 kids. It would be quite a shame for me to have to tell him that his salary will have to be reduced and he'll still be expected to support me to come here and talk to you for often 15-hour-plus days.
Thank you, Mr. Rice. Thank you.
So please support the DDA budget.
Thank you so much, Mr. Rice, for your advocacy. Next, please.
My name is Katie Donahue. I am an archivist aide at the Archives of American Art. I've been there for 10 years. I got the job through Project Shorts, which is run by SEEK, a community provider. They taught me how to do interviews, how to set up a 401k, how to do daily things to get and keep a job and prepare for the future. I've been connected to SEEK for 12 years. The first few years of my job, I had a job coach who was very fundamental in helping me have a clean office, helping me fill out my timesheets to get the basics of what to do for my job. I did travel training with SEEK right before I started my internship. And now I can take public transportation. I commute by metro every single day. I have been a board member for SEEK since 2019. It has been an amazing experience. I've met such wonderful people, and I've learned about things like how to communicate and how to help get my story told. It has really increased my confidence. SEEK is a lifesaver for anyone going from schooling to finding something to do and not just sitting around. It gets people out and about socializing, which is very good. I know it is very good for me. We should be at the table to talk about the future of programs like SEEK and DDA. Representation, you can't decide anything without the person or the group represented. It's not fair. Thank you.
Thank you so much for your wonderful advocacy. Thank you.
Thank you to Chair Shetty, Vice Chair Jones, and Deputy Director Hutchinson for their collaboration. My name is Katrina, but today I am speaking as Linda Copeland, a DSP who is at an all-day training. Hello. For over 40 years, I have wholeheartedly dedicated my career to supporting individuals with disabilities, serving as a direct support professional. My journey began in my teenage years while volunteering with Special Olympics, a transformative experience that sparked a lifelong passion. In 2003, I joined SEEK, a community provider, and was thrilled to contribute my skills and love to this vital work. I have assisted individuals with daily activities, personal care, and companionship. Now, as a job coach, I empower individuals to find and maintain fulfilling employment. I guide them through job searches, assist with resume writing, help prepare for interviews, and teach essential workplace skills. My on-the-job support ensures my clients succeed and truly thrive in their roles. My goal is to promote their well-being and independence, prioritizing their rights and ensuring they feel valued and respected every step of the way. As a supervisor, I lead talented professionals in our mission, always striving for the highest standards. I focus on fostering a motivating and supportive environment where our staff and those we support can excel. To ensure I provide the best care possible, I have pursued extensive training in various areas, including HIPAA, abuse and neglect prevention, seizure management, safe lifting techniques, and person-centered planning. This knowledge equips me to prioritize the rights and needs of those I support. One of the most inspiring moments of my career has been working with a young woman who experiences severe seizures and has limited speech. Initially, communication was a challenge, but through patience, creativity, and various gestures, I've taught her over 200 words. And after 18 years of working together, I am proud to have helped her secure a job at Montgomery County Public Schools, where she continues to shine. My journey reaffirmed the importance of personalized support and innovative communication in enriching the lives of those we serve. It is a tremendous privilege to make a meaningful difference in our community daily, and I ask you to protect our DDA budget. Thank you.
Thank you so much.
Chairman Shetty, members of the committee, my name is Tim Weens. I am the Executive Director of Maryland Inclusive Housing. We were formed 5 years ago to help DDA transition from a group home model of residential services to more of a supported living model. So if individuals don't live in group homes or choose not to live in group homes and can't live with their families, where do they live and how do they manage that to find affordable, accessible housing? And that essentially is our charter. That's what we do. And we do that in a variety of ways. And I've included details about that in my written testimony that I've submitted to you. We are included in the DDA budget as part of a grant for $260,000 that funds our operation, and I'm here to ask you to support that appropriation. I'd also like to ask you to support another item in the budget. DDA started a rent subsidy program 2 years ago. This year it's become fully operational. It works similar to a voucher program, providing funding for people to live in their own housing. And both that budget and our budget are sort of flat funded from FY25 into FY26. We know that the state and DDA in particular are facing financial challenges in the FY26 budget and going forward. MIH, in collaboration with DDA, is working to build new housing models and has collaborated with DDA on technology, both of which have the potential to create new pathways for more person-centered services and services that are financially sustainable. We look forward to continuing to work on those issues with DDA. Thank you.
Thank you so much for your testimony. Do any members of the subcommittee have questions of this panel? No. Thank you so much. Appreciate it. I want to just take a moment to ask if Kashena Cross is here. I don't see them. Okay. We will move on to the next panel of 5, please. David Knoppenberger with Concerned Citizens for Self-Direction Maryland, Jane Plappinger, Rachel London with the Maryland Developmental Disabilities Council, Scott Thigpen, and Susan Hartung. That's 5. So if you hear your name, please join at the front. I see Miss London is coming up. Okay. So I see 4 people have come up. I just want to see if I need to call another. David Knoppenberger, are you at the table? Great. Jane Plappinger, great. Rachel, I see you. Scott Thigpen, okay. So Susan Hartung, coming. Great. Okay. Welcome. You may go in whatever order you wish. Thank you.
Thank you, honorable committee members.
Turned your mic off.
Thank you, honorable committee members, for giving me the opportunity to speak today. My name is Jane Plappinger, and this is my son, David, who is 23 years old and receives DDA services. David lives in Montgomery County in a group home operated by Chimes and attends a day program operated by another community provider, Seek. David moved into a group home when our home became unsafe. Like some people with autism, David had behavioral episodes where he became dysregulated, and my sweet, kind, affectionate son would hurl himself into walls and windows, throw hard objects, and attack me. It was after a particular episode when David struck me with full force in my head and almost broke my neck that I finally agreed to a group home. I am pleased to share that the group home environment has been stabilizing for David, and he is doing great. He is happy, safe, and busy, and he will tell you, Mom and Dad are proud of me. I am terrified, however, that David's group home could close if they lose the geographic reimbursement, differential reimbursement rate, and are unable to hold on to their staff. If it closes, David could become homeless. Another concern is the proposed reduction in dedicated staff hours, which could result in David becoming a prisoner in his home if he doesn't have a dedicated staff person to take him to activities of his choosing in the community. David's day program, Seek, will also lose its geographic differential reimbursement rate. This will no doubt impact its ability to hire and retain the amazing staff, one of whom you just heard from, that work with David each weekday. I understand the need to find budget reductions, yet a 22% reduction just seems too high. I also believe that through collaboration with community providers, alternative cuts could be identified that would do less to harm David and the many others who rely on DDA-funded services. Thank you so much for the opportunity to speak today. I have also submitted written testimony for your review.
Thank you so much. And just on that note, this is the binder full of testimony that we've received in writing, and our members do have access to it on their floor systems as well. We absolutely will read all of the testimony submitted as we will actively pay attention here and engage. So thank you for your testimony, and thank you for sharing David's story with us. Next, please.
Thank you, Chair Shetty, Vice Chair Jones, and distinguished subcommittee members. My name is Dave Knoppenberger, and I am the parent of two very sweet but incredibly challenging children who receive services through DDA's Medicaid waivers. I want to start by saying I challenge the state to strike or at least reduce the cuts to DDA that have been proposed in the fiscal year 2026 budget. The disabled community is incredibly vulnerable and should be the last group to see heavy-handed budget cuts in a state as wealthy as Maryland. I also want to express my support for both the traditional and self-directed delivery options for the waiver services. Both models have their place, and participants should be able to choose the model that works best for their circumstances. That said, I am incredibly dismayed by the targeting of the self-directed model by DDA in the upcoming cost containment measures. In our family's experience, self-direction has been a lifeline for us, and the proposed cost containment measures would absolutely decimate this program, leading to severe disruption to our children's lives and loss of services, which DDA says they want to minimize. DDA keeps talking about the out-of-control self-directed costs, but the numbers they have provided to you don't back up that idea. In their December Joint Chairman's report, the data showed that self-directed participants spend about 20% less than traditional, saving the state $20,000 to $30,000 per participant over the last 3 fiscal years. It also shows that as a percentage of their budgets, self-directed participants used only about 50% of the money that was approved for them, while traditional participants used over 60%. So the whole idea that self-directed participants are somehow blowing out their budgets is false. They only use about half of their approved funds. Again, I point this out not to negate the need for traditional services for some individuals, but to highlight how self-directed is a win-win-win. It pays staff a living wage, allows disabled individuals to customize their plans to their own needs, and has the potential to save the state money. Please don't cut DDA's budget, and don't allow DDA to continue to implement these punitive cost containment measures. Thank you.
Thank you. Next, please.
Thank you. My name is Scott Thigpen. Good afternoon, delegates and Chair Shetty. I appreciate the opportunity to be here and tell my daughter's story. Before I do, I want to thank the legislature and the governor for the restoration of most of the FY25 cuts. I trust that spirit of cooperation and collaboration can continue into the FY26 challenges. I'm the father of Alexa, a 25-year-old autistic woman. She has complex medical, emotional, physical support needs. She has a genetic condition that presents as intellectual disabilities, seizures, autism, bouts of physical aggression, severe anxiety, and difficulty adapting to the complexities of community settings, which includes loping, which is a fancy term for running out into traffic unexpectedly. Due to Alexa's conditions, traditional services is not an option. She tried several programs, but her needs were too complex. She enrolled in SDS in 2023, now attends the Montgomery College Challenge program for people with special needs. She takes art classes to pursue her dream of opening her own Etsy store, and she started her own business helping family and friends with small chores. The cuts envisioned by DDA would devastate self-directed services. Wages, if they are as proposed, would barely be above minimum wage for a job that requires significant emotional, physical, and mental investment by the staff. SDS cannot offer the benefits that traditional jobs can, fringe benefits on job coaching and support during times of crises. These people are on the front line with very fragile and very emotionally fraught individuals every day in community, and they need to be recompensed for that. If implemented, this would necessitate a complete change out of Alexa's staff, which would be devastating to her. Being autistic, she relies on stability. We understand that changes need to be made and everyone has to tighten their belts, but the solutions offered by DDA don't do it in a sustainable way. I would ask that we pause on the November 20 policy changes in the manual to examine whether these are producing unfair barriers to getting or hiring staff. Sorry, and then I would take the pause in the waiver to really investigate opportunities for DDA, traditional providers, and SDS parents to devise creative and equitable solutions to this challenge. You have some of the most creative people in the world who work with us every day, and we're willing to work with you.
Thank you, Mr. Thigpen. Thank you for your testimony. Next, please.
Good afternoon. My name is Susan Hartung. For 55 years, I have worked or volunteered in programs serving people with developmental disabilities. I have seen the best and the worst of programs. My husband's aunt lived most of her life in Rosewood. For that reason, I cheered when the Great Oaks Center opened, and then I volunteered there, and I cheered when it closed. And then as time went by, my professional perspective changed to a very painful personal one. By 1995, my husband and I were raising 4 children. My son Warren has a rare genetic disorder that leaves him without speech or the ability to take of any care of his personal needs. My daughter has autism. And then we have Graham and Matthew, who have no disabilities. But our lives were basically overwhelming. Caring for every one of them was too much. More than one doctor suggested that we consider institutional care for our 2 children. But having seen what that looked like, no, that was not the answer for us. Then one day a social worker said to me, "You need to apply to DDA. They're getting ready to unlock the waiting list." Within a few months, thanks to DDA and the provider, Community Support Services, my 2 children, Warren and Emily, were able to attend an after-school program 1 day a week. And what that meant for the first time, my husband and I could attend our boys' baseball games without worrying about the behavior or needs of Warren and Emily. More than that, for the first time, Warren and Emily were able to go to a program where they enjoyed the activities they were doing. Over the next 15 years, that led to more activities after school, on weekends, respite services, help in our home. We were able to become better parents to all 4 of our children. Today, thanks to Community Support Services and DDA, my 2 children live in separate townhomes in their community with a roommate and staff that not only take care of them, but truly love them. They are part of the fabric of that community. They work, they volunteer, they go to the gyms, they shop, they eat at restaurants, they take care of their homes, and they come home to see us almost every weekend. The life they lead today, I can tell you, was not available 35 years ago. It was unimaginable. And if you do the budget cuts that are proposed, there are providers that are going to have to close their doors, and there are families that will have no choice to consider institutional care. And we and you just cannot let them happen. Thank you.
Thank you for sharing your story. Ms. London.
Madam Chair, members of the committee, for the record, I'm Rachel London, the Executive Director of the Maryland Developmental Disabilities Council. I want to first express our thanks for the leadership of Governor Moore, the Budget Committee leaders, for really figuring out and developing a plan to avoid most of the cuts in fiscal year 25 and committing to continuing engaging to help us figure out and find solutions moving forward. Feel a little bit like you've heard the best of the best, and I'm at the end of a panel that has shared all the things, but just want to point out a couple of things. Really what you're hearing is we need to ensure that people with developmental disabilities can choose the way they've received their services, whether that is they choose to self-direct or they choose to receive services from a provider. Both are clearly important to people. I think what you've also heard is that changes can occur, but any actions, whether they're funding or policy changes, really cannot put people at risk. And ultimately, really changes that are made should build the capacity of both models so that Maryland has a strong, well-funded service system that supports the Marylanders with developmental disabilities that we know about, and ultimately those that we don't know about yet. One just sort of reminder, going back to the basics, everyone, regardless of service model, how they receive their services, gets services based on their assessed need and their person-centered plan. And everyone has different needs at different points in our lives. We know that. It's no different for people with disabilities. And services do need to be flexible enough to meet those changing needs. So thank you for figuring some out. We commit to continuing to work with you and the administration to find solutions with the least amount of impact on people with disabilities, their families, direct support professionals, and providers.
Thank you so much, Ms. London. Question from Madam Vice Chair.
Thank you so much, Chair. I want to thank all of you for sharing your personal stories. That means so incredibly much. Ma'am, you spoke about your sons and their ability to have their own schedule so that then you could go to baseball games and the quality of life of the family. That was incredibly impactful, so I wanted to personally thank you for sharing that. Mr. Knoppenberger, you said you have 2 children who use self-directed care, is that right?
Yes, that's right.
How would these cuts affect your family if you were to, at this point now, we saw what happens when we got them, and how would that affect your family?
We have 6 staff that work with our 2 kids, and I am heartbroken to tell you that, they've worked with our kids for years, some of them, some more than that, and a good portion, maybe all of them, would probably move on because they would see huge, 20, 30% pay cuts, and no one is going to stand for that. I can't blame them, and they would move on, and we would have to probably lose services for a while. Maybe we'd find somebody to work for those lower rates, but again, they're barely over minimum wage, and it is a hard job. I mean, I challenge anyone to come to my house and work with my son for an hour and get hit and kicked, or work with my daughter and get your hair pulled and tell me that they're making too much money.
Thank you so very much.
Thank you, Madam Vice Chair. Thank you, panel. Okay, thank you so much to this panel. We appreciate your testimony, and we will absolutely take it under advisement. Appreciate it. We'll now move to panel 3 of our advocate testimony in the order in which they're listed on my sheet. Ken Capone, Ann Confer with Jubilee, Daria Cervantes with ARC, and Andy Culp with ARC, and Karen Adams-Gilchrist with Providence of Maryland. Do we have all 5 of those individuals here? Sorry, can you tell me your name again, please?
Daria Cervantes.
Okay, and?
Ann Confa.
Great, and okay, 3, 4.
Andy Culp. Ken Capone is unable to come. His ride, which is his direct support professional, was ill.
Okay, thank you for letting me know. Then we'll ask Rick Callahan to join, please, enter ACC Compassing. Thank you. Okay, you can begin in whatever order you wish. Thank you.
Good afternoon, Chair, Committee, families, and our individuals that we serve.
Could you please microphone closer? It's a little hard to hear you. Thank you.
My name is Ann Confer, and I've been a direct support professional DSP at Jubilee Association of Maryland for 10 years. Jubilee is a nonprofit community provider that supports 200 people and has nearly 500 employees. Most people who work at Jubilee are DSPs like me. I love my job because it allows me to make a meaningful impact in the lives of the people I am blessed to serve every day. Seeing their personal growth is my lifetime reward. I received advanced DSP training, which has significantly enhanced high-quality support to the 3 women who rely on me. Eliminating the geographic differential rate and the dedicated hours policy change would cut $6.8 million or 19% from Jubilee's budget. If Jubilee had to cut my wages by 19%, this would cause me irreparable financial stress. I would have trouble meeting my essential expenses. Many DSPs live paycheck to paycheck. A 19% cut would put Jubilee's starting wage below the minimum wage in fiscal year 2026. I worry how these budget cuts would affect my fellow DSPs and the people we support. I support 3 ladies in a Jubilee group home. One of the ladies has state-only funding. Jubilee has supported her for nearly 30 years. I help her with medication, cooking, community involvement, and many, many more. She recently received a letter stating she has 30 days to apply for the Medicaid waiver. As far as we know, she's not eligible for federal funding, but her family is scrambling to complete this application per the state's order. They worry the support that helps them be independent is at risk. Jubilee has not received information on if the state will continue to support people who are deemed not eligible for the Medicaid waiver. I am worried these fast-moving changes will interrupt services for her and the 19 others supported by Jubilee with state-only funding. Please reject these harmful cuts. Marylanders with disabilities are relying on you. People like me who provide these life-changing services are relying on you. And our work is very, very hard, and so please consider that.
Thank you.
Thank you.
Thank you so much for the important work you do and for your testimony. Next, please.
Good afternoon. I'm Daria Cervantes. I'm the CEO of the ARC Montgomery County. We employ more than 400 hardworking Marylanders and support over 300 people with DDA funding. As I sit before you today, nearly a third of the people we support in our residential program have fallen out of the Medicaid waiver. But we've continued to provide supports without knowing if we'll ever be paid for them. To date, we've provided more than $5 million worth of supports that have yet to be paid. I'll focus my testimony today on stories of how these proposed cuts will impact real people with real lives. Rebecca's story illustrates the challenges we're already facing. Rebecca has quadriplegia, uses a G-tube, has a seizure disorder, and cannot move on her own. She needs 2-to-1 support to transfer in and out of her wheelchair, which we have been providing even though we've only been funded for 1-to-1 support. This year, though, DDA rejected her request for 1-to-1 dedicated hours that have been in place for years because these needs are intermittent. However, we can't predict when those intermittent needs will occur, which makes it impossible to schedule staff intermittently. In the meantime, we continue to provide 1-to-1 support, actually 2-to-1 support, without funding, because not providing this funding, the support will lead to dire consequences for Rebecca. We have filed an appeal several months ago, and just about 2 weeks ago, we got an acknowledgement that the appeal was received, yet we still have no hearing date. My next story is from a mother I'll call Mary, and I'll read it to you in her own words. I'm the mother of a 41-year-old man with multiple developmental disabilities. He's held various jobs with help from the ARC. Working is very important to him and gives meaning to his life. A low turnover of DSPs working with him has provided the stability he needs to function effectively. Paying staff a decent wage helps keep these hardworking employees stay at their jobs. My son would have an unhappy and invisible life if he did not receive DDA supports. Now, I understand that there are fiscal challenges that the state is facing, but these fiscal challenges cannot be solved by threatening decades of progress made to the civil rights of people with developmental disabilities. I ask that you remember Rebecca and Mary's stories as you make the difficult decisions that lie ahead. Thank you.
Thank you so much. We will. Thank you. Next, please. Hi, good afternoon, Madam Chair Shetty and Vice Chair Jones and members of the committee. My name is Andy Culp, and I'm here to testify on behalf of the ARC Maryland in support of the governor's budget with amendments to the DDA budget for fiscal year 26. We oppose the more than $400 million in cuts into the DDA budget that's proposed, which would represent a 22% overall cut to services and supports, impacting approximately 20,000 people with intellectual and developmental disabilities who receive DDA services annually to live, learn, work, and thrive. I want to note I'm truly grateful for the recent opportunities we've had to engage with members of this committee and also with the DDA, and for your compassion and open doors. I want to focus my remarks today on the environment we've lived in over the past year and the environment that is needed for us to be able to resolve some pretty big issues and ensure that we're not in front of you again next year with the same problems. Over many decades, we had an enduring DDA system culture of assisting people with disabilities, helping providers be viable, and helping families get what they needed. We had relationships of mutual respect and trust, and it worked. But this relationship has deteriorated over this past year in particular and has been replaced with uncertainty, confusion, and fear. The transparency replaced with opacity. And during this time, there have been many changes with little notice or input. We've experienced increased denials for services people need and have had for years, even as we had repeatedly been told there have been no changes to policies. Providers are forced to provide millions in uncompensated care with continuing billing issues, and we've watched the very policy changes contemplated with this budget's cost containment proposals being implemented almost verbatim. Dedicated hours and one-to-one supports, awake overnight supports are being pulled away. People who self-direct are noticing they're unable to use their approved funding. So in closing, I want to again say that we do appreciate the recent opportunities to dialogue with the DDA administration and hope we can work together to restore the system that is consistent, reliable, trustworthy, and responsive. We've proven time and time again that we are always in a better place when we have opportunities to be at the table and work together to put the humans back at the center of our human services. Thank you. Thank you. Thank you so much for your testimony and your work. Yes, please.
Good afternoon, Chair Shetty and members of the committee. I'm Karen Adams-Gilchrist, and I'm the President and CEO of Providence of Maryland, a community provider that supports 323 people in Anne Arundel and Charles counties. I'm here today for the same reasons that almost everybody is, to express my deep concerns about the proposed cuts. Cuts of this magnitude will no doubt change how providers like Providence deliver services and will significantly disrupt people's lives. And this is not something that we can do. We cannot do this to people who count on us. Dedicated hours are critical to supporting people's choice and how they spend their time at home and in the community. Just imagine if we all had to do everything with the people we live with every day. I know I couldn't do that. Imagine having to include everyone in something that's only important to you, but everybody has to be included in it. Imagine reaching retirement age and not matter. Reducing dedicated hours takes away choice, and for many, removes a lifeline. I want to share just a quick little story. Let me tell you about Ann. She was a beloved person that we supported for years. Ann was 83 years old when she died. A few years earlier, Ann decided to retire, and it was through dedicated hours that we supported Ann to live an active, productive life, full of things that were important to her and with people who were important to her. It was dedicated hours that allowed us to care for Ann when she was diagnosed with cancer. And it was dedicated hours that allowed Ann to pass away with dignity in the comfort of her home, with her family and staff by her side. Coming home was important to Ann and her family. I can't imagine the despair Ann's family and our staff would have felt if we weren't able to support her through this. You've heard us say repeatedly, save our services and we won't go back. I urge you to restore DD funding to save our services so we won't have to go back, because we really can't go back. It would be tragic if we did. Thank you for the opportunity.
Thank you for your testimony and your work. Thank you.
Good afternoon, Madam Shetty and members of the Health and Social Services Committee. Thank you for the opportunity to voice my opposition to the $457 million cuts to the DDA budget. My name is Rick Callahan. I am the Executive Director of Compass and co-chair of Interact, which is a coalition of 40 nonprofit organizations serving over 4,000 people with IDD in Montgomery County. These funding cuts will have a devastating impact on people with IDD and their families. They would destabilize essential services, force providers to reduce or limit supports, and to put the health and safety of people with IDD at risk. We cannot afford to undo the progress that is made. We must protect these critical investments. We urge you to preserve the GEO differential to address the unique cost pressures faced by the providers in the GEO region. Maintain this differential ensures higher DSP wages, lower turnover, more job opportunities for people with IDD, and expands capacity to the growing supports needs of people with IDD. Cutting this support risks workforce stability and limits access to essential services for people who are most at risk. Preserve the current dedicated hour supports policy. These dedicated hours are necessary, not optional. Cutting these services is not just a financial decision. It is a life or death decision for some of the most vulnerable citizens. Eliminate the current practice of reducing long-standing dedicated supports for the people with the most intense needs. We should not ignore what is happening in DC and the potential cuts to Medicaid. These cuts are a willing forfeiture of $200 million in federal dollars. Maryland has a choice. We can continue to move forward in supporting people with IDD, or we can fall back into crisis. Thank you.
Thank you so much for your testimony, panel. We really appreciate it. Do members have any questions for this panel? Okay, thank you. Thank you. We will now move to our next 5 witnesses signed up. Again, in the order on my list, we have Laura Howell with Max, Robert Baynard with Opportunities, Inc., Cody Stevens with SDAN, William Simmons with Providence of Maryland, and Mike Kokiolik, Providence of Maryland. We have all 5 here. I see 4, 5. Great. Thank you. You may begin when you're ready. 2 minutes, please. Thank you.
There you go. Good afternoon, Madam Chair and members of the committee. My name is Rob Baynard, and I'm the CEO of Opportunities Incorporated, a community provider of DDA services to over 200 people living in Montgomery and Prince George's counties. I also serve as the chair for the Prince George's Provider Council, a membership organization of over 35 community providers delivering an array of services to over 2,000 people living in Prince George's County. I am here to express my deep concern regarding the proposed cuts in the DDA budget. Our state is facing very difficult financial times right now, but these proposed cuts will result in real and significant consequences for people and their families. The growth over the past couple of years has allowed community providers to increase wages to ensure our direct support professionals are earning salaries commensurate with the jobs that they are performing. Additionally, community providers are starting to make progress with stabilizing the direct support workforce, which has been a challenge over the last 15 to 20 years. These cuts will undo every bit of the progress that has been made. My organization and those in the Provider Council operate within the geographic differential rate area. We all understand the continual need to examine rates to ensure fairness and adequacy, but removing the differential rate from counties where the cost of living index is anywhere from 9 to 23 points higher than the Maryland average is going to lead to lower wages for DSPs, and our workforce will shrink quickly, creating significant service disruptions for thousands of people. Combining this cut with the proposed revision to the dedicated hours policy will result in providers not having the resources to meet the needs of those in services. And I'm concerned about those people and their families that rely on our support each and every day. Maryland has made great progress over the past few years, and our services are revered as being some of the best in the country. The provider community has always been willing to come to the table to work with our state agency partners to discuss and tackle these issues, and that willingness remains in place. Sustainability of services is paramount for both the DDA and community providers. We must work together so that both sides can understand the impacts of cuts like these before they are ever proposed.
Thank you. Thank you so much.
Sure.
Thank you. Ms. Howell.
Good afternoon, Madam Chair, members of the committee. I'm Laura Howe with the Maryland Association of Community Services. We represent about 125 community providers across Maryland. And most importantly, to start with, I want to thank you and Chairman Barnes for your commitment in caring for Marylanders with developmental disabilities and your work this session with stakeholders. We truly, deeply appreciate it. We spent a lot of time this session talking about the black box of DDA and questioning its growth. And the first thing I want to say is when you starve a system for as long as the system was starved financially, you will see growth in order for it to survive. For years, there were no rate increases. And just to give you one example, over a 7-year period of time, the entire increase over 7 years was 0.7%. Second, of the $195 million in rate increases just in the last 2 years, 90% of that was tied to the minimum wage acceleration. So regarding the two major cuts to funding for community providers, you all know the elimination of the geographic differential rate is really critical. And I want to say it creates what's been proposed creates a statewide rate, but it creates a statewide rate without including the data from those 5 most expensive counties, and that would be a significant problem. It would lower the rates in those 5 counties, but to do a true statewide rate, you would have to include that data, which would then increase the rates in the other 19 counties. And as you know, the change to the dedicated hours policy basically just collapses the funding structure for many of the homes. So I want to just emphasize one last thing, which is that this cut in particular, this dedicated hours policy cut, we've been seeing for months. It is deeply frustrating, very concerning, and we really, really need that to stop and to turn around and for those cuts to be restored for those people. Thank you.
Thank you.
Good afternoon, and for those that don't know, happy Rare Disease Day. All right, my name is Cody Stevens, and I'm actually representing over 100 families on the Eastern Shore today. My 9-year-old son Luke has a severe disorder called polymicrogyria. It affects his speech, motor function, cognition, emotion, severe seizures, and more. Our lives have been far from steady, filled with therapy trips, doctor visits, emergencies, and his 2 major brain surgeries. Luke requires constant assistance in all aspects of his life, not excluding bedtime. For most, a typical work week is 40 hours. For our family, it's 168 hours a week per person. As we care for Luke 24/7, yet we only ask for 40 hours of support individually to manage this responsibility. Holding a full-time job with a traditional boss becomes unrealistic, as our child's needs are always going to come first. We've often heard statements like, be here at 4, consider it your termination, something that I'm sure many families behind me have heard something like that before. But let's be clear, we live and breathe for our son's needs. There is no plan B. Our home life has been unstable as we've had to move in order to access doctors, resources, jobs, and support. Luke is just now starting to feel safe and secure in a home where he can thrive. The challenges of raising a disabled child are daunting, but the DDA Family Supports Waiver has provided us with the critical support we've needed. This waiver has allowed us to stay by Luke's side, ensure he gets the care he needs, provide him with medical equipment to live with dignity. It's created a consistent environment where he can grow properly and where his support team are not just professionals, they're his friends. If these supports are taken away, it would be catastrophic for him. For the first time, he's remembering his letters and numbers at 9 years old, and he's excited to learn each day through homeschooling. Without the consistency these services provide, he will regress, self-isolate, face emotional triggers, sending us back into crisis mode, where we've lived. If these cuts go through, families will be forced to consider institutionalization, which has resulted in neglect and abuse in the past. Just ask them. This will also cost the state far more in the long run. However you look at it, the quality of life of thousands of disabled loved ones from across the state are going to take an unbearable hit, one our families may not be able to ever fully recover from. Clearly, the budget cuts are going to hurt everyone involved. State and families together should oppose these budget cuts and get back to what's important, Maryland citizens and their families, instead of a bottom line. Thank you.
Thank you for your advocacy on behalf of your child.
Good afternoon. My name is William Simmons. I'm a direct professional support professional with Providence of Maryland. Good afternoon to Chair Shetty and the members of the committee. I serve 3 men in Providence of Maryland that count on the services that we provide. I was very saddened when I heard about the proposed cuts over $450 million. One thing I know that I value my work. I've been doing this for over 11 years, and I work with many of families, not only in personal supports, but I was a job coach, and I watched the way that their lives and their family lives have changed and how they impact the communities, both in Anne Arundel County and throughout Maryland. I'm here today with one of my favorite friends that I have worked with for for at least 11 years, Michael Konchelik, and I'd like him to introduce himself to you.
Hi, I'm Mike Konchelik, and I came from Maryland, and I'm the assistant coach for Old Mill High School since back in 2014. And I'm very proud to be able to do it. Helping the new bocce players, and my teacher, Miss Wally, back in Old Mill, and we won an Old Mill High School championship at the bocce game at Washington College. And we won a gold medal that year. And we're proud of ourselves the way we are.
Talk about how your life has changed since you've been in Providence.
Okay, and I feel good about it. And me and Will Simmons sits back in the Providence Center and the Pottery Studio and now in Serrano Park.
The impact has been very great. Go ahead. You want to talk some more?
Oh, no.
Okay. The impact has been very great in this county and throughout Maryland with the services that we provide. Mike's mother actually called to our center to have me work with him personally. I really do hope that you consider changing the plan to cut these, to make some changes and restore these services because, like you heard so many people before I came, these services are needed to make the changes in people's lives and sustain their families as well as make an impact in the community. We are part of all of these families, and so it's necessary that you do all the consideration that you can to keep us going. And I thank you.
Thank you so much to the panel for your testimony, and congratulations on the victory of your team. I'm sure it was in large part due to your contributions, so congratulations and thank you for that. Do any members of the committee have any questions for this panel? Seeing none, thank you so much, panel, for your work and your advocacy. We're going to now call up the next 5 individuals on the list, please. We have Vivian Smalls with Providence of Maryland, Robert Malone with ARC of Prince George's County, Donna Nyoku with Concerned Citizens for Self-Direction, Lisa Shames, and Carol Freed. Do we have all 5 individuals here? 1, 2, 3, 4, 5. Great. Welcome. You can begin. Thank you.
Great. Thank you, Chair Shetty and Vice Chair Jones. Appreciate you as well. Chairman Barnes being here. My name's Rob Malone. I'm the lead executive for the ARC Prince George's County, and here to testify to ask you all to consider again finding ways to eliminate a lot of these budget cuts. I just want to quickly frame my remarks this way. A couple of weeks ago, I got a call from a parent. They have my cell phone, so I got a call from a parent, and he said, your staff called me to explain some changes, but there were some things they didn't understand or didn't explain clearly, and I just kind of left confused, and so he called me. But as he was talking, he said, I told your staff, I said, if Mr. Malone has reviewed this and approved this, then I trust it. It's fine. And as he told me that, I felt really proud. I almost teared up. But I also rebound that to you all, because really, we're just a service provider. We're a contractor of the state of Maryland to support the residents of the state of Maryland. And so while we, are direct line, or at least my staff are direct line, they cannot do that without your support and leadership. And I've seen that leadership, especially over the past couple weeks, and I want to say thank you. And then I'll just let you know quickly about the regional rate differential, because we're in Prince George's County. That alone would reduce my budget by $6.8 million. In my testimony, I framed how those calculations work. That automatically means we're going backwards with staff that we've lifted wages for, we've lowered vacancy rates, we've reduced turnover. And essentially what it equates to is every time there's turnover in the lives of people with special needs, it is very devastating. And so I'm sure you've heard that today. And so I'm simply asking you to find ways to modify that budget. Certainly that regional rate differential needs to be studied and cannot just be simply eliminated. Thank you for your time.
Thank you so much for your work and testimony.
Good afternoon, Chair Shetty and members of the committee. My name is Vivian Smalls. I am a direct support professional with Providence of Maryland. I am also a mother who counts on DDA service for my daughter who lives her best life. I'm here today to urge you to restore funding to the DDA budget and to tell you just how important the funding is to Crystal and our family. Crystal lives in the community living home in Charles County and with the support of Providence. She lives with 2 other women who have disability. Crystal has epilepsy and has frequent seizures, some of which have led to emergency room visit. We work very hard as a family and with Providence to get the extra support that she needs. When that funding was finally approved for dedication hours, it was a life changer for Crystal and for me. I'm here to ask you to help our family, to help ensure that Crystal can continue to count on her staff. Her seizures puts her at risk each and every day. Her staff ensures her safety. They make sure that she cares for during a seizure and that she doesn't injure herself. You can't imagine the peace of mind that provides for me, having someone dedicated to Crystal's needs. Also means the women she lives with have the staff to support them to do what they want. Crystal staffs are a big part of her life. She builds friendship with them, and they make sure she has the active life she wants, doing things that she loves to do. They go to church, they go to movies, concerts, shows, and out to dinner. And that's one of Crystal's favorite, to go out and eat. And at home, she loves to read and work on puzzles. She deserves this, as well as all we do, to enjoy life with security and dignity. I see people living their best life every day with the support of DDA funding. I'm extremely concerned that their lives could change with such large cuts to the budget we count on. People deserve better. Crystal's life would look very different without the support she received. My life would look very different. I would have to provide round-the-clock support for her, and I would not be able to work and support my family.
Thank you. I'm so sorry, ma'am. Your testimony is so compelling, and we so appreciate it, but we must move to the next person. Would you like to have a moment to just wrap up the remaining?
When I see Crystal today, she is always smiling. She is happy, and I know she is secure, and I don't want that to change for her. Please save our budget.
Thank you, ma'am. Thank you. Next, please.
Good afternoon. Thank you, honorable committee members. Madam Chair, my name is Donna Njako, and I'm the parent of Forbes Kelechi Njako, who is autistic and nonverbal. He's over in the back there. I come to you today, before you today, with deep concern about how the changes to policies of the Developmental Disabilities Administration, DDA, made since the late fall of 2024 are undermining the very principles of the Self-Direction Act of 2022, which was proposed to empower families and individuals like mine. Forbes started receiving services in 2014 from the Self-Direction program and has had the same support worker for 8 years. Because of his stability in his routine, he has made several milestones during this period in his life. For example, Forbes is now able to follow to two-step directions consistently. He also has gained traction with his level of anxiety. Forbes was the first 5-year-old to attend Kennedy Krieger Institute School in the LEAP program due to his severe behavioral issues. Before attending Kennedy Krieger, he was at Ivy Mount School in Rockville, where they could not address his severe behavioral issues. Therefore, he was placed at the Kennedy Krieger Institute. I was full of hope when he was referred to KKI, and I thought at this point that his problems would have been resolved. But little did I know that I was dealing with a lifelong disability. And to compound his issues even more, he lost his beloved sister Shelby in 2001. Shelby was his only playmate at this point in time. She was the only person he was able to imitate, copy, and this devastating loss at this stage in his life caused him to descend into the abyss. The Self-Direction Act was a beacon of hope for us when he graduated from high school, promising greater autonomy, choice, and control over the care our loved ones receive. It was a step forward, a recognition we know best how to care for our family members, and that we should have the freedom to make decisions. And that self-direction was key to supporting people with disabilities to live in the community. As a matter of fact, it will cost more to put our disabled children in group homes, which will lead to them reverting to some old behaviors, plus other kinds of issues that will arise from such decision. Other than the self-directed program of 2022, DDA should look deeply into their decisions as to avoid a case of penny wise, pound foolish.
Thank you.
We are at a breaking point. The actions of DDA have made the self-directed program unsustainable. The state of Maryland must uphold its commitment to protect its most vulnerable residents. Your supportive legislative action today and during this session can do just that. Thank you for your time and understanding regarding this matter.
Thank you for sharing your story. Thank you.
Thank you for the opportunity to testify regarding the DDA funding bill. My name is Lisa Shames, and I'm the parent of an adult daughter, 80, who has severe disabilities. 80 lives in a group home with the ARC Prince George's County and I serve on the board for this organization. I'm greatly concerned about the potential cut to the geographic rate differential. As you just heard from Rob Malone, that cut would result in a loss of $6.8 million to our chapter. On a daily basis, my daughter requires assistance with her basic activities of daily living. She is nonverbal. The direct support staff are essential to her life and to her safety. An example of this is when staff noticed one morning that Adie was not her usual self and was not eagerly getting ready for her day program. Instead, she was moving very slowly and haltingly. The DSPs at her home accompanied her by ambulance to the nearby hospital. Adie was admitted and subsequently airlifted to Children's Hospital, where she had been getting cardiac care since she was a preteen. There, Adie had emergency surgery. You see, she has been completely dependent on her pacemaker for years. And if that malfunctions, her heart will slow down or just stop. That morning, Adie was unable to say, "I feel bad." I credit the regular morning staff for recognizing that she was not her usual self and took immediate action. As you can see, Adie's health needs are complex. She relies on staff to administer medications at the right dosage and at the right time. Adie's needs are also comprehensive. For example, she even depends on staff to brush her teeth twice a day because poor oral health could worsen her heart issues. This is a huge range of responsibility that starts first thing in the morning and ends at night. Working with individuals with disabilities is not easy. It's physically and emotionally taxing. If you cut the regional differential, it would be a shock to the DDA system in my region. I dread that staff will choose other minimum wage jobs that are not as stressful. Staff turnover causes major disruptions for Adie, her housemates, and others with special needs. I urge you to make sure Adie and so many others with developmental disabilities have stable staff and ultimately a good quality of life. Please protect the DDA geographic rate differential.
Thank you. Thank you for sharing your story. Thank you. Next, please.
Good afternoon. My name is Carol Freed. My son, David Mitz, is 39 years old. He is severely intellectually disabled and has received supports from the Jubilee Association of Maryland for the past 7 years. His favorite direct support staff has been with him all 7 years. David requires one-on-one services to keep him alive. These services are now at risk. He was born with a rare and severely disabling intellectual disability. Although he is ambulatory, he has an extremely strong drive to walk constantly. Unfortunately, he also has an unsteady gait and requires someone by his side to prevent falling. Additionally, he has no understanding of danger, so will walk into the street without safety concerns. He cannot speak and shows his preferences and needs by taking someone's hands. He also requires help with all areas of personal care and feeding. Furthermore, David rarely sleeps through the night despite sleep medication and will need to walk and watch music videos. Sometimes he settles down, sometimes not. After 18 years of getting dedicated supports, DDA is now questioning his need for one-on-one help. As stated previously, David is supported by the Jubilee Association of Maryland. It's a remarkable organization committed to providing safe, dignified, and rich community lives for its residents. That dignity extends to all of its employees, including fair compensation so employees can live in our community as well. Governor Moore's proposed cuts, including the elimination of Montgomery County's geographic differential rate, are frankly shocking and would be a devastating blow to Maryland's most vulnerable citizens and all the nonprofits and families in Maryland's DD community. It is truly hard to imagine how the nonprofit DD community can sustain itself and how we will continue to hold on to its staff and attract more employees with these proposed cuts. Thank you.
Thank you. And I want to just take a moment to really thank all the parents that are here to share stories of their wonderful children and how they're thriving under these programs. It's really special to hear. Many of us are parents and on this side as well, so we appreciate all that you go through to provide love and care for your kids. So thank you. Questions for this panel? Delegate Ruff.
Thank you, Madam Chair. Ms. Freed, thank you for your testimony. You're the second person I've heard talk about a change happening to the one-on-one services. Can you give us just a brief understanding of why that's changing now?
Well, my understanding is that they need more specific documentation about the need, and you know, so we're in that process. There have been several iterations of this, and they need, you know, I guess, data to support the fact that he's up all the time, needing to walk all the time, stumbling frequently, and that somebody really needs to be by his side to prevent falling. He has had several falls this past year and required urgent care, stitches, and you know, you know, it's the way his brain works that he needs to walk all the time. That's something that he really loves to do, and believe me, his father and I helped him learn how to walk, which he started at age 6.
I can't imagine.
And it's like he hasn't stopped, excuse me, he hasn't stopped since, you know.
Well, is that process a little different? Is it different than the process you've had to
We have never had to document the way we are now, and we are in that process, and we will continue to do so.
Thank you.
Yeah.
Thank you. Madam Vice Chair.
To follow up on Delegate Ruff's questioning, you said that you've never had to, first off, thank you so much for sharing with us.
Yeah.
As a fellow mother. You said you've never had to document to this extent before, and you're going through the process. Could you put how long has this process been of your documentation and going back and forth with paperwork?
Well, I would say it's about 6 weeks, and yeah. It's been about 6 weeks.
And it's still going on, right?
It is still going on, yes.
Okay, thank you.
Thank you so much, Madam Vice Chair. Other questions? Great. Thank you, panel, for your advocacy. Thank you. We'll go to the next 5, please. Laura Lear, Community Support Services, Inc. Sam Jones, same organization, Community Support Services, Inc. And Adam Wyndham, Angela Knoppenberger, and Robert Stone. Do we have all 5 available to testify? I see some movement, so that's good. 1. Do we have, I think, okay, 1, 2. Okay. Thank you. 1, 2, 3, 4. Okay. Great. Thank you so much. Welcome.
Thank you, Chair Shetty and members of this committee. I'm Angie, parent of Elsa, 18, and Luke, 15, both with special needs with multiple disabilities, receiving DDA self-directed services, and at the most restrictive of the non-public schools. Do you know what it's like to be a parent of a special needs person? What about 2 of them? It's like you're in fight or flight mode all of the time. You don't know when they're gonna have a seizure, behavioral meltdown, bad night's sleep, which for us is nightly. They always need help. You can't leave them alone. You want the best for them, but sometimes you just can't do it. It is chronic PTSD at its very core. You have to rely on other people when they are outside your care and trust that they are doing what is best for them. Can you imagine that feeling? Now imagine you have an agency whose name is Developmental Disability Administration, set up to help people with disabilities. In previous years, an agency that has been on your side, supported you with services that really benefit your children. And for some reason, they stopped being on your side. You send them emails, they either respond very late or not at all. They stop allowing services for your child that were previously given with no explanation. When you try to get one, you feel dismissed. Can you imagine how that must feel? You already have a huge permanent challenge, and it feels like the people who are supposed to help you have turned their backs. That is what it has felt like in the last year with DDA. It is incredibly sad that we have to rely so much on our delegates to fix this. I know that this is a lot for you all to handle. Please, I am begging you for me and for all the caregivers out there with children with special needs. Investigate this change before giving DDA a budget when it feels they are not on our side. Thank you.
Thank you for your testimony. Thank you.
Good afternoon, committee members. My name is Adam Wyndham, and I'm here today as a parent and advocate for individuals like my daughter, Emily, who have intellectual and developmental disabilities. I am deeply concerned about the proposed cuts that will cause irreparable harm. Let me be clear. I did not walk into Burger King and order a child with disabilities to live off the state. Emily did not ask for this life. I didn't ask for this life. I wish I'd made different choices in life where I was more affluent and didn't even need help. But at 19, I joined the Air Force trying to find a greater purpose in life, not knowing the life that would lay ahead. My story today is one of an exhausted dad. For 7 years, I've had to fight for everything. And here I am again, fighting against a system that claims to help the disabled, but seems designed to break us. Emily's regression began during a move back to Alaska, after we were forced to leave once before during the so-called budget crisis and hiring freezes of 2013. After having to fly to Seattle Children's and learning my 2-year-old daughter has some rare condition I never heard of, I was told we should move. Since day one in Maryland, nothing has been easy. Hospitals in Baltimore wouldn't see her for months, though early intervention is supposed to be critical. A specialist in New York got her in within a week. State offices sent me in endless circles, no one willing to help until I contacted a legislator. To this day, I still have to do that. This shouldn't be normal. It should be unacceptable. The school system wanted to isolate Emily in a special center away from general education peers. I fought to get her out, only for them to try to put her back in. I had to move school systems to get her the inclusion she deserves and inclusion that has been successful for her. I've had a speech pathologist tell me she had a master low tech before she could have a high tech device. I've had a physical therapy assistant say, why bother? She's never going to walk. These aren't just isolated incidences. These are the attitudes baked into the systems that make our life harder for families like mine. Systems where waiting months for a wheelchair or a year for a speech device is considered acceptable and normal. How is that humane? I'm simply exhausted. The constant battles, the endless red tape. These budget cuts should have never.
Thank you. I want to just, before we go to the next person, thank you, sir, for being here both yesterday for the very long BRFA hearing and today. Your testimony is very, very powerful, and we really appreciate it. I know there are many advocates in this room that stuck it out with us in BRFA and are here again today, so I just want to take a moment to give special thanks. Thank you. Next, please.
Chair Shatti and esteemed members of the committee, my name is Samuel Jones, and I am here with Joe Gray. Let me tell you our story. When Joe was 8 years old, he became a ward of the state and was placed in Great Oaks Institution. Joe has profound intellectual disability and is nonverbal. With no one to speak for him, there were no choice for Joe. In 1990, I moved from Sierra Leone in search of better opportunity. I worked various entry-level jobs until a friend told me to apply at Great Oaks, promising higher pay. I came for the money, but stayed because I fell in love with the people I supported, including Joe. At the age of 31, Joe's life changed when he moved into a townhouse operated by CSS. I followed him to CSS and began working with him as DSP, earning $6.75 an hour, 50% more than the minimum wage at that time. I experienced Joe's transformation firsthand and what it meant for him to finally have choices. At Great Oaks, Joe has no say in his life. In his new home, everything changed. He learned to cook and eat without fear of having his food stolen. Joe got to experience so many firsthand, including vacation to Canaan Valley. For Joe, It was more than a getaway. It was freedom. It was a life that they had unimaginable at Great Oaks. Those life in the community is possible because of people like me and my colleagues. The proposed budget cut to DDA jeopardized DSP wages, salaries for support staff like me at risk. I have seen this before. If these cuts go into effect, we will lose dedicated staff. We will lose their knowledge, their expertise, because they will move on to look for better pay. Hiring quality DSP will be difficult. The people who we support, people like Joe, deserve our very best. We are counting on you. Thank you.
Thank you for your testimony, and thank you, Joe, for being here too. Thank you.
Thank you. Chair Shetty and esteemed members of the committee. My name is Laura Lear, and I'm the CEO of Community Support Services. The proposed DDA budget cuts have significant implications for the people we serve and the DSPs who support them. These cuts will take funding back to unsustainable levels, and we will not go back. Let me tell you about John. As a teenager, MSDE sent John to school in Florida due to his intellectual disability and his complex medical and behavioral needs. As an adult, DDA placed him in an out-of-state institution. When John was 32, he finally came back to Maryland and moved into a townhome operated by CSS. With the support of DSPs, John has built a meaningful life. He's worked a variety of paid and volunteer jobs and enjoys cooking, swimming, and celebrations with his friends. John will not go back. Let me tell you about James. James has autism and profound intellectual disabilities. He was sent to school in D.C. until he was hospitalized in a neurobehavioral unit in Baltimore. He lived there until he turned 21, then he was sent home to Silver Spring. Without services, his mother had to care for him alone and struggled to meet his needs. When James began receiving DDA services, he had no vocational skills, limited experience in the community, and often required intensive 2-to-1 support. With years of structured learning and DSP support, James now lives a very different life. The intensity of his needs are more than his single mother can provide, and she relies on additional supports so that he can safely continue living at home. James is not going back. We cannot go back. Without adequate funding, community providers who support thousands of people like John and James and Joe face an uncertain future. Reducing DDA funding, which receives a 50% federal match, further reduces revenue to the state of Maryland. Current rates were established based on multi-year funding study, and cutting rates without proper time and data to evaluate the impact is reckless. The funded rates have allowed us to recruit, retain, and train dedicated DSPs needed to support people like John and James and Joe. Turning back funding levels would be a betrayal of that progress. We must never go back.
Thank you. Thank you so much to this panel. Madam Vice Chair for a question.
Thank you so much, Chair. Thank you so much for sharing your stories. I wanted to ask, there was a lot of talk about services without explanation that have been cut off and or emails that have gone not returned. Could you give us a subject area? Could you give us examples, please, of that?
Sure. Sorry. I am actually speaking on behalf of many parents, so this is not just my story. I just want to say I'm sorry, Chair.
Oh, here.
Delegate
Ruff.
Okay. You talked about Ms. Renwick replying to you, right? Well, many parents don't get replies. So we send a message, maybe if there's a plan that has been in clarification mode, or there's a plan that is being wait to be approved again, that has needing a new approval, and there's no response. Weeks and weeks of no response. And then we don't get services that were previously given. So let's say you have a plan, right? And then a new plan is in place for the next, for the next year. That you have to get it approved. But there's clarification after clarification. Sometimes clarification mode goes in for 7 or 8 months. I am not the only parent. There's many of us who are waiting months and months and months for plans that were previously normal, like that were approved, are not getting approved, and there's just no response time. I don't know if that makes sense.
Okay.
No, it does. It does, and it helps clarify. I appreciate it. Thank you very much. Thank you, Chair.
Thank you, Madam Vice Chair, and thank you for the response. Thank you, panel. I see no further questions from our group here, but really appreciate your time and testimony. I just want to make sure I had on the prior panel Robert Stone. Is Robert here? Okay, we'll come back to Robert if we see them. The next panel is Michelle Gregory, then Tracy Smith, Patricia Saylor, Alicia Sindorf, and Jen Drucker. Let's hold, please, for a moment. Thank you. One moment, please. Thank you so much for joining us. Okay, you can begin when you're ready. Thank you.
Oh, hi, Madam Chair and committee. Pardon my disjointedness today because I'm pivoting to tell you a different story than I had planned to tell you because people have covered it better than I ever could.
Could you please introduce yourself?
Absolutely. My name is Patty Saylor. I'm a nurse, and I've been working in self-direction for 20 years since the very first person ever went into self-directed services, and my son self-directed his services until his death in 2013. I want to tell you about Jack. I met Jack when he was, and I just got permission from his dad to tell his story. I met Jack when he was planning to leave Rosewood State Institution. He's in his 50s now. Jack spent almost his entire life institutionalized. He still had the love of his parents from outside those institution walls. He has, I have to say these things even though I prefer not to discuss Jack in this way. Jack has nonverbal autism. He has bipolar disorder. He has severe PTSD. He's very severely impaired by his disabilities. He left Rosewood, and we were fortunate to get him in self-direction because providers all passed. They said, no thanks, he's too hard, can't do it. So we got him in self-direction, and I was asked to be his nurse because Jack is insulin-dependent diabetic. And I was warned that if I go close to Jack, he might take my head off. But, you know, being who I am, I'm thinking love cures all. You know, I'm going to be the empath, and I'm going to try to serve him. And I got into a relationship with Jack. And Jack understood that I was a safe person, and we could work together. So Jack's staff actually came with him from Rosewood. And he moved into a row house in the city in East Baltimore. And his staff, I want you to hear this. He has had almost no staff turnover in 16 years. He is staffed 2-to-1. 2-to-1 during all waking hours because those staff need to be able to be nimble. They need to be able to support Jack. If Jack decides to go through a plate glass window, he's going. So they have to be able to support him. Now, fortunately, through relationship, Jack trusts them. Jack is no less disabled, but he is safe. He feels loved. When he was in the Rosewood, he would be sedated, papoosed, and on a gurney to go to a doctor's appointment. Within a year of living in his own home with the staff who were there for him, he was able to get to a doctor's appointment if it was done well, in and out fast.
Ms. Saylor, we so love hearing this story, and we're so grateful. But would you mind just starting to wrap up, please?
Absolutely. So the last couple of years, it's been tough to get his plan through. It's been questioned. And we think that'll happen again. So if these cuts go through, Jack is at risk. Thank you.
Thank you. Thank you. Next, please.
Good afternoon. My name is Alicia Sindorf, and I'm here to ask you to reject the proposed cuts to self-direction. I would specifically like to advocate for my daughter, Mackenzie, I brought a picture, who has Rett syndrome and is nonverbal and non-ambulatory. The state benefits that Mackenzie receives through the DDA and the REM program are essential to her well-being and safety. The DDA waiver program has been life-changing for our family since Mackenzie started receiving services in 2023. This program has provided support for our daughter to be a more active part of her community, receive essential health care not covered by insurance, and help provide a stable and safe home. In addition to being Mackenzie's mother, I have been a registered nurse in Maryland since 2012. Prior to Mackenzie being on this waiver, I would work 2 to 3 evenings and weekends per week just to make ends meet and attempt to save for both of my daughter's futures. This waiver has allowed me to be a personal support for Mackenzie, and that is something I am eternally grateful for. Because having a nonverbal daughter in any sort of care facility is terrifying. As her mother, I constantly worry about her being mistreated or neglected, and this has allowed our family to control who provides care for her. The traditional model of care has proven to not work in our area as there is a shortage of nurses and staff. Mackenzie was on a wait list with 2 agencies to provide traditional services for over 4 years. I acknowledge the current financial crisis our state is in and that change needs to happen. However, there are major issues across this state with participant-approved plans, lack of knowledge about what services are available to families, and communication between state agencies. I recognize there is only so much money in the budget, so I encourage officials to find solutions to lack of communication and investigate areas of fraud and abuse to help our state budget instead of penalizing and jeopardizing my daughter and other disabled members of this state just trying to survive. Governor Moore said yesterday that the budget should respond to the needs of Marylanders. Well, the proposed budget cuts to self-direction do not respond to the needs of individuals with disabilities. Rather, they put these most vulnerable in a place where they will be at much risk. I thank you all so much for your time today and the opportunity to advocate for Mackenzie. It is not something I take lightly, so thank you.
Thank you very kindly for this opportunity to address you. Hi, I am Jennifer. I am the 55-year-old mom to Cassie, my 25-year-old daughter. I'm a single mom with no financial assistance before joining self-directed services. I had Cassie right before earning my master's degree, giving me no chance to establish a career. Their dad couldn't handle autism and exited. I must rely on outside help just to accomplish basic things like grocery shopping. And it can't be just anyone helping me. It has to be someone who understands Cassie, someone deeply familiar with her needs and behaviors, because she has no understanding of danger. Cassie has profound autism, epilepsy, rapid cycling bipolar disorder, and hearing loss. Because she can't communicate, her anxiety is high and her behaviors can be extreme. To avoid meltdowns, we stick to strict routines. Self-directed services gave Cassie a life, a community to engage with, and purpose, and it gave me a way to survive. For the first time, I was able to be compensated for some of the hours I care for her, a necessity when I'm on duty 24/7. Often her care requires 2 people because I'm not strong enough alone. Day programs were unable to handle her, so self-direction was our only choice, and I'll never give up on my daughter. When we joined self-direction, we were shown a chart of pay rates, and we followed the rules. I made financial decisions based on these assurances. I signed a lease, and I budgeted. Now pay is being slashed. I will no longer be able to afford our home, or even to put food on the table. No apartment or townhome will tolerate Cassie's behaviors. I know this because I've been through it. So we will have nowhere to go. To make matters worse, our main caregiver just left because of the instability DDA is causing, and there's no job security, so she took a private pay job. With the cap on goods and services, Cassie will no longer be able to have even 1 hour of activity on weekdays. If you pass these cuts, you're not just balancing a budget, you're breaking families. My daughter's care is not a line item, it's her life and my life. We depend on these services to survive. Without them, we will fall into crisis, and my daughter will be left without the care she needs. We are already stretched beyond our limits. Do not ask us to endure the impossible. Protect these services, because without them, we will not make it.
Thank you so much. Thank you.
Good afternoon. Thank you all for hearing our stories. Just a side note, I am an elected official. I serve on the City Council of the City of Salisbury on the Eastern Shore, and I have been on the other side of the desk receiving a lot of public comments all at once, and I know it's a lot. It's like a fire hose, and I appreciate your patience as we all let you know how we feel about this. My name is Councilmember Michelle Gregory. I represent District 4 in the City of Salisbury, but I am here today as a mother, a caregiver, and an advocate. My eldest son, Nick, is profoundly disabled. His condition was so rare we didn't receive a real diagnosis until he was 18, Lennox-Gastaut syndrome, a severe and treatment-resistant form of epilepsy that forever shapes his life. When Nick aged out of school, we feared for his future.
A brief attempt at a day program led to more seizures, hospitalizations, and constant staff turnover. The system failed him. But in 2017, we found a program, self-directed, that allowed me to become a paid caregiver. The impact was immediate. His seizures dropped from dozens per day to about a dozen. Hospital visits fell from every few months to just once or twice a year. Later, after years of rejections, my husband was finally approved as a caregiver too. Today, Nick has 2 dedicated caregivers, his parents, working 80 paid hours a week. But in reality, his care is a 24/7 commitment. You heard another person say today that it's 168 hours. I know. I count them every week. This program doesn't just provide salaries. It keeps a roof over his head, allows him to be part of a community, and gives him access to vital medical care. Without it, the alternative is full-time institutional care, costing the state hundreds of thousands more per year while reducing the quality of his life. As a member of City Council, I understand tough budget decisions, but these cuts won't save money. They will create greater costs and devastate families like mine. For every voice you hear today, there are hundreds more unheard, terrified for their loved one's future. I urge every legislator, reject these cuts for the 2026 fiscal year. Find another way. This isn't trimming fat. This is cutting families like mine to the bone. Thank you.
Thank you so much for your testimony. Members, do you have any questions for this panel? Okay, thank you. Thank you for being here today. I want to go back and make sure that I didn't miss Tracy Smith, who was we called up as part of the last panel. Tracy, okay. We're going to go now to the following panel. Elizabeth LaFrance with ESTAN, Jennifer Gallatin, Jessica Gallatin, Randy Ames, and Christopher Rogers. We can, actually, ma'am, I see that you're, sorry, in the blue shirt with your back turned towards me. I see that you're coming. Do you want to wait until the next panel? Would that be okay with you? And then that way you have more space? Okay, great. Thank you. Okay, we can do this panel. Please proceed. Thank you.
Okay, I'm not Elizabeth LaFrance. I'm asked permission to read her testimony because she got a flat tire. Okay. She requests full funding of the DDA budget. She is the treasurer of Self-Directed Advocacy Network. In avoiding disclosure of its Bureau of Labor Statistics wage proposal, the DDA is hiding the severity of the wage cuts to self-directed services, along with the fact that they are imminent. Early last year, the DDA began wholesale denials of services despite demonstrated need. Last fall, they choked off access to resources with the new self-direction manual. And now the DDA is asking the legislator to codify the cuts that will shatter self-direction by taking caregiver wages to the bone. The DDA wants to reduce self-direction wages by 64% of FY24 spending, or $235 million on spending, of less than $367 million of current spending. Participants will be forced to break their commitments to the direct support professionals who support them. They fear instability and chaos will result. Talk of cuts is already making staff flee, leaving families to fill the care gap, while many face their own financial ruin. Bankruptcy, eviction, homelessness, and institutionalization are being openly discussed. Participants who have already achieved independence have it even worse. She spoke to a mom who asked how to break the news to her son's staff, not just because it's a difficult topic, because we have no details about what the BLS wages will actually be. If they leave him, she may have to quit her job to care for him and take the devastating pay cut for herself and churn through a series of other low-paid staff. The administration intends to go forward with these plans, but you don't have to help them. Please fully fund the DDA in the hopes that it will change under incoming MDH leadership. Thank you.
Good afternoon. Thank you, Chair Shetty and committee members for being here today, taking your time and commitment, providing your commitment to finding solutions. My name is Randy Ames. I'm a managing attorney with Disability Rights Maryland, the state's protection and advocacy agency for people with disabilities. I agree with what you've already heard from many panelists that there's been progress, but not enough. And what we're looking at with the budget cuts is will be harmful and will force us backwards. In 2023, the General Assembly received a final report on the healthcare workforce crisis, and the title had the word crisis for a reason. We haven't resolved that workforce crisis, and these budget cuts will make that worse. I want to share a client story. His pseudonym is Tim. Tim lives in Allegheny County, and unfortunately, he doesn't have family members or informal supports. He relies heavily on his direct support workers, and one day his main direct support worker had to call out because she had her own family emergency. Tim then spent an entire weekend in his wheelchair without a means to leave his house safely, to leave his wheelchair, to change his clothes or his incontinence diaper. Tim's biggest fear, though, that weekend was he was going to have a medical crisis, end up at the hospital, and be forced out of his home and into an institution. If we continue to cut and ask the most of the people that have the least, Tim will end up in an institution, and so will other people who unfortunately don't have family members who are willing to overstretch themselves. The state these cuts will be shifted to the state in the form of additional ER visits, hospitalizations, and institutionalization in violation of the American with Disabilities Act and Olmstead, the case that requires community integration. We are talking about participants and direct service providers that do the most with the least, and now we are asking them to do even more with less. For these reasons, Disability Rights Maryland requests that we find a way to maintain DDA's current funding and find ways for improvement of the system. Thank you.
Thank you so much. Next, please.
Hi. Good afternoon, delegates and Madam Chair. My name is Justin Stocker. I'm an individual with the Developmental Disabilities Council of Maryland. I am an individual with low vision and cerebral palsy. I receive services from Opportunity Builders, a service provider in Anne Arundel County. They are integral in helping me with my work with Liberty Healthcare as an advocate reviewer. They help me log into my virtual meetings as well as drive me to my in-person meetings. They also are very integral in helping me on my days off with my social life, with the friends that I have. Yeah, they are very supportive in helping me with that. And I'm not sure where I'd be without DDA's funding. I also have a twin brother who has more challenges than I do. He cannot see whatsoever. He loves going to Opportunity Builders every day. They help him with going to the bathroom as well as helping him eat lunch. They also help him with activities as well as taking him out to the mall at least a few times a week. He loves Opportunity Builders as much as I do. And the DDA funding helps make that possible for us to go there at least 5 days a week. Thank you very much for your time.
Thank you for your testimony. Thank you. Are you testifying as well, ma'am, or? No, okay. Any questions for this panel? Okay, thank you. Thank you for joining us today. I think I have, okay, so Jessica and Jennifer, yeah, okay, great. And then the only other person I have on my list that we've not yet called is Richard Calm. Is Richard here? Yes, okay. Are there individuals that are in the audience that have not spoken, but you believe that you were on the list? Can you raise your hand if that's the case? Okay, just want to make sure we didn't miss anybody. And I thank you all for being here and for your patience. This is our final advocate panel. You can begin when you're ready, or you can wait. It's up to you. Thank you.
Good afternoon, and thank you for this opportunity. My name is Rich Combe. My daughter, Kate, who is deaf-blind, gets DDA waiver services in the self-directed or SD model. She started in the traditional model but had to switch to SD because of frequent issues of neglect due to staff maturity, training, and availability. Agencies in traditional were not willing or able to provide for Kate, and only the SD model could protect her health and safety. Current SD wage levels are needed to hire and retain staff to provide appropriate care for Kate's complex health care needs. In traditional, our issues were caused by agencies that could not pay adequate compensation to staff or supervisors due to high corporate overhead. The wage rate was so low that even with generous benefits, total compensation was not enough to retain and motivate staff. Higher rates with lower benefits avoid this problem in SD. The FY26 SD wage cuts are harmful and disproportionate. At over $146 million, they are over 25% of total SD budgets, while total cuts are 31% in SD and only 6% in the $3.5 billion traditional model. News about DDA includes stories of a staggering shortfall, in quotes, of $350 million from billing issues in traditional. We believe DDA's restrictions on current SD spending and deep cuts in the FY26 SD budgets deflect attention from this shortfall. They imply that growth in SD budgets is the major contributor to DDA budget problems, and this is just a misrepresentation. Rule changes and budget restrictions are already doing great harm to self-direction. Please reject wage cuts from the smaller, lower cost SD model. Thank you.
Hi, good afternoon, guys. Is this one? Sorry. You have both of us down to testify, but this is my sister Jennifer, and I'm Jessica, and she is nonverbal. We tried to take a little bit of a different approach today, so just bear with us. We tried to, what's why we signed both of us up, to shed some light, because we've sent a lot of testimony in, and we talked at a couple of other hearings. So today, with Jen's permission, we didn't send this to you as written testimony, but we printed out a transcript of what it's like to sit in on one of her PCP clarification meetings, and I'd just like to read through a few of the quotes. And if anybody would like the transcript or the recording, I'm sure that Jen would be willing to share it with you. First one is from the CCS supervisor. Basically, the main thing that the clarification request is requesting that enhanced one-to-one support for certain services, and that there's no assessed need in there. It has been communicated that it has to be in a behavior plan or a nursing care plan. RN, quote, it won't be in a nursing care plan because it's not within a nurse's scope to practice to discuss staffing ratios, so we're not allowed to do that. Nurses are not allowed to discuss staffing ratios. They will not approve 2-to-1 in the community. I wouldn't even try and fight it because they just won't. It's not worth holding up the plan. The only way to get around it is if you submit an official appeal, and then trust me, they're still going to deny it. Nurse, quote, so the reason you'll get one-to-one staffing is because there's no justification. I completely understand. I actually sat, my quote, I completely understand. I actually sat through the nursing delegation training to see what DDA had discussed, and they made that very, very, very clear. However, that leaves all of us in a predicament where it's like there's no reasonable path to get enhanced or one-to-one. Nurse, quote, You're fighting a losing battle. It sucks. But to get the plan approved, you have to take out the one-to-one. You have to take out the enhanced rates. They would not approve it. And if you push and you push and you push, they will take your DDA hours and they'll make you get CFC and increase. It just happened to a family I had. She pushed and she pushed for it. They reduced her DDA hours to 40 hours and made it increase the CFC. You do not want them to do that to you. My quote, I completely get what you're saying, I really do, but I'm not easily intimidated. And to be completely honest, I would have to take care of my sister with or without pay. But I do kind of have to push for what is true and honest and correct, right? Nurse quote, unfortunately, the only way to get this plan approved at that way would be to file an appeal or hire an attorney. That's the only way they'll approve this plan. Nurse quote, unfortunately, that right now, this is the reality of DDA. You can fight and you can fight and you can fight, and they're going to keep denying and denying and denying. You can. The only way right now is to file an appeal. That's the only way you're going to approve this plan as it sits right now. Otherwise, they're just not going to approve. My quote. So I think that I appreciate all of that. I think that we've been aware of all of that. What I don't want to do is add behavioral. What I'm not a big proponent of is creating more services and more costs for no reason. You know what I mean? Especially when we know that this can be addressed the way that it is. Sorry. My quote. There's a lot of personal, private information in there. That's why I was thinking maybe that the importing the document section could be utilized a little bit better. It's not within your scope to delegate staffing ratios, but it's 100% within the scope of the physical and occupational therapists and our doctors to say how many people or caregivers are needed to help her stand or position or bear weight, any of these certain functions. This is what they used to justify this service previously. Nurse quote. Sorry, I'm getting to the end of this. My recommendation would be to change the PCP, take out enhanced, take out the staffing ratios, submit it with the care plans, the redone HRST, and they'll approve it. Trust me, they'll approve it. They'll get it approved tomorrow. I don't want to tell you not to, but smart plan would be to take out the things they're not approving, get the plan approved, and then do a revised PCP and have supports behavior added in. And I said, okay, so maybe I think it's important that DDA clarifies that medically complex participants in this program, and it's not set up for them. It's set up for the behaviorally complex participants. It seems like the only way we can get our information heard is through a behavioral assessment. This obviously has to get you, mulled over by Jen. I don't work well with threats, and I also don't back down easily when I know that she needs this. I do think that our route may be to explore the behavioral assessment type thing, if that's going to be the easier way to get them the documentation that they need.
Ms. Gallatin, thank you so much. This is incredibly powerful testimony. Because you had signed both you and your sister up, we extended to 4 minutes. Okay. But we're coming to the end of it, and I just wanted to see if you want to just finish with like 1 or 2 sentences, please.
Sure.
Thank you.
I'm sorry, I'm just going to move to the last one here. My last one here that I noted was, I can understand that they can't understand, because to be honest, I didn't understand, and she's been my sister my whole life. I didn't understand what my dad was talking about or what he went through until now, and I'm feeling it. But I don't want to die at 58 years old.
Thank you. Thank you for your testimony. I see, first, thank you. Thank you for both today and yesterday. One moment, please. We do have a question from a delegate. Please, if it's okay. Delegate McCaskill.
Thank you, Madam Chair. I actually don't have a question, but I am feeling compelled to speak to this group while we have you in our presence. And so, just as you needed a minute to get yourself together, this has been, I just feel it would be remiss to not say something. And so, to the agency, I am grateful that you stayed here to our closing. And I hope that with hearing these families' testimonies that you maybe look into some things operational and procedural that can help make these families whole. And then to us as legislators, and even to you as families, I want to say thank you for not giving up and determining to move and press forward. And to those of you who are here this evening to even advocate for yourself. You see, I am a mother, but I don't have children with special needs, although they have been challenging. However, I grew up with a family member that I'll say name is Dee, who is now 52 years old. And fortunately for him, he had a village. We did not have to institutionalize him. He had each of us, and each of us had each of us, and each of us had each of us in the family. And so we had moments where we could retreat back to our normalcy. And obviously, a lot of you do not have such a luxury. And so I know it is charged on us as a committee to figure out the budget. And we can't figure out the budget on emotions, but what you came here to do today, you did exactly that. And so I want to say thank you. But each time that we look at each line in the budget, we will remember your faces and your testimony as we decide on the hard choices. So, Madam Chair, I just wanted to say thank you for allowing me for the time. And again, to these families, I just want to say thank you in advance for all that you have done and all that you will obviously continue to do. And I just want you to please stay encouraged as we move forward through this budget. Thank you, Madam Chair.
Thank you, Delegate. So thank you, panel, and thank you all of the advocates that have testified. We're going to do something that we don't typically do in our hearings, and I hope that the department will allow us this opportunity. But we're going to ask our final panel to please, you may take your seats again, and we're going to ask Deputy Secretary, would you mind coming back just for a couple just brief moments. I know we have one delegate who has a question that he'd like to follow up on. And we also would like you to have an opportunity, if you're able. First, thank you again for sitting with us in community here and hearing the voices of the many advocates that are here and that I know you've been engaged with for many, many, many months. And I want you to have an opportunity to respond to anything you've heard that you wish. So I'll start by please recognizing Delegate Ruff. Thank you.
Thank you, Madam Chair. And thank you for taking the opportunity to allow me to ask just one additional question. I thought I was going to hear some testimony about the LIST program. And I didn't hear that because there are obviously some much bigger issues that have been addressed in this room today, because LIST is a smaller, obviously it's a much smaller portion of your budget, but I did get questions about it as we were leading up to today's hearing. So I kind of wanted to know, based on my understanding of what LIST does, there's about 2,000 to 2,500 Marylanders who this really creates a stopgap for. To have, I think about $2,000 that they can use flexibly to address maybe gaps in cover, gaps in services, or unique types of equipment that they might need in order to make life easier. And I was wondering if you could respond to the proposed cut to that program and the philosophy behind it, and any measures that may kind of replace that.
So the original proposal was to submit a BRFA item that would eliminate the LIST program. We did not proceed with that. For fiscal year 2026, we will continue working with the executive branch. We will continue working with the legislature as well as our community partners on all of these cost containment measures in order to build a system and invest in a system that we can sustain for DDA. So originally it was to eliminate lists, and we are not proceeding with the elimination for fiscal year 2025.
Was that proposed in an amendment that I missed?
That was a BRFA item. It was supposed to proceed as elimination, and for fiscal year 2025, we did not pursue eliminating the LIST program.
That's right.
Okay.
Thank you, sir.
Thank you.
Thank you. Madam Vice Chair.
Thank you so much, Chair. Deputy Secretary, I wanted to give you the opportunity to, and your panel, to reply. We had heard several families talk about their plans that they would send back in for approval, and that their emails or their plans they didn't get a response. And sometimes a few families indicated months that they had waited. I wanted to give you the opportunity to reply to that.
Absolutely. So thank you for allowing us an opportunity to speak to the compelling testimony that we heard this afternoon as well. I took copious notes and I jotted down every person's testimony as I think about how I can better lead my team and work with the community and work with the legislature as well as the executive branch as we shore up the system at large. Hearing these challenges, these are not the first that the department has heard, and we are working very closely with our case management agencies. We're also working very closely with our team members. We're providing training. We are also providing training for our support brokers at large. The system is complex. I will not disagree with some of the challenges that I've heard here today, but what I can commit to you is our commitment to be at the table with everyone to work through these challenges.
Thank you, and we really appreciate that commitment. I want to, before I turn it to my chairman for final remarks, I want to see if you have anything further you felt you would like to respond to, or if you would like us to just continue this conversation.
Again, I started with our commitment to be at the table with all stakeholders, and so we are going to continue these conversations with the stakeholders, that being providers, families, participants, as well as the executive branch and the legislature to move forward.
Thank you, ma'am. So I just want to take a moment before I turn it to my chairman, just to thank again everybody who has joined us today. Thank you for your many calls, your emails, your engagement on behalf of yourselves and your loved ones, the providers, everybody that's been an incredible stakeholder in these discussions, as well as the department. I really, really appreciate it. It's been immensely helpful, and I am very grateful, Madam Secretary, for your commitment to get us those numbers, please, before Tuesday of next week. Before we conclude, I'm going to turn the floor to my chairman, Ben Barnes.
Thank you, Madam Chair. I just wanted to thank everyone who came here today to share their stories. I think what you saw with Delegate McCaskill's beautiful words is that you really have, I think, moved each and every one of us here today with a range of emotion between anxiety and what might happen if these cuts are fulfilled, to joy in seeing your commitment, frankly, and your love for these beautiful humans. And I think that's meant a lot to everyone on this committee. I want you to know before leaving here today that the Appropriations Committee has made its #1 priority this session to restoring as many of these cuts as we can manage. And since we've received the budget, I want you to know that Chair Shetty and this committee have worked tirelessly to identify the cuts that will do the most damage to identify cost savings in the budget so that we can restore as many of these cuts as we can. And that is not just this subcommittee. Every single subcommittee on the Appropriations Committee has been instructed to find savings where they can in this budget with an eye toward trying to restore these cuts. I can't promise that every cut will be restored. What I can promise is we will do everything we can to find the savings to do it. Thank you for a great hearing, Madam Chair, and thank you all for being with us.
Thank you, Mr. Chairman, for your wonderful words and for your commitment to this incredibly important community. With that, I want to thank again everybody for joining us, and this hearing is adjourned. Thank you.